Hello, I'm Erina Moon, a second-year PhD student at the University of Toronto, and I'll be presenting research I conducted with Dr. Shion Guha, my advisor. Today, we discuss our paper, A Human-Centered Review of Algorithms in Homelessness Research, a systematic literature review that examines the technical underpinnings in algorithms developed for homelessness. To provide context around the topic of the study, the UN estimates approximately 1.6 billion people in the world live in inadequate housing. Homelessness is a critical humanitarian challenge as unhoused individuals experience stigmatization and discrimination when seeking access to necessities, employment, and healthcare. Recently, Canada and the US are seeing rising numbers of those experiencing homelessness, and major cities have declared states of emergencies as the availability of homeless support services such as shelter spaces and permanent housing can't keep up with demand. As a means to mitigate rising demand for homeless support, public agencies in the US and Canada are adopting data-driven approaches to identify and allocate support services to clients. Along this vein, the federal government in the US and Canada mandate the implementation of centralized systems known as coordinated systems within homelessness as a means to provide consistent, efficient, and evidence-based service delivery. Coordinated systems take on a data-driven approach, maintaining centralized real-time data on clients and available homeless support services to match clients with available services. In light of increasing interest in data-driven approaches for homelessness, our study wanted to critically examine the technical underpinnings of algorithms designed for homelessness. We wanted to understand how algorithm design choices impact those who regularly interact with the models and identify research gaps. Our approach to do this was by synthesizing existing decision-making algorithms in homelessness research. So in this study, we conducted a systematic literature review to ask the following research questions. 1, what computational methods are employed when building algorithms for homelessness? 2, what predictor variables are used to build algorithms for homelessness? And 3, what target outcomes do algorithms for homelessness predict? For our literature review, we searched the ACM Digital Library, IEEE Explore, Springer, Routledge, and Elsevier for peer-reviewed papers or reports published by governmental agencies that discuss the technical components of algorithms designed for homelessness. So in this slide, we show descriptive characteristics of our corpus that met our scoping criteria. We identified 55 peer-reviewed papers, of which most of them were published in computer science or social science venues, and we also identified 2 social science agency report papers. Some papers include algorithms designed specifically for the unhoused youth, family, veterans, and so on, reflecting the heterogeneity of those experiencing homelessness. Our first research question, which examined computational methods used in algorithms for homelessness, found inferential statistics and machine learning approaches were the most preferred methods. Among inferential statistical approaches, 35 models used generalized linear models. Logistic regression models were the most common GLMs, accounting for 43.1% of algorithms in our corpus, and machine learning approaches were also a popular approach, with many using supervised learning approaches, primarily random forest and decision tree models. Our review of literature showed that authors often prefer GLMs and machine learning models like random forest and decision trees because they were explainable. They could explain how predictors influence the outcome variable, an important attribute on homelessness, as homeless systems often involve regulatory practices where accountability and transparency on how allocation decisions are made are emphasized. We also noted an interesting trend in computational methods over time. While inferential statistics and ML approaches have consistently been used in algorithms over time, we noted the new emergence of optimization approaches. By design, optimization methods offer advantages, as they offer an algorithmic methodology to consider the temporally dynamic ecology of homeless services. Specific methods under optimization approaches included network analysis and mixed integer programming, and the rise of optimization approaches coincides with the implementation of federally mandated coordinated systems in the US and Canada. These approaches differed from ML and GLM models as they shift the focus from identifying or categorizing who unhoused clients are to considering what services are available to them within the homelessness support system. Next, our study looked at the predictors employed by the algorithms. The key takeaway from our findings was that algorithms for homelessness have consistently used easily quantifiable and available demographic, health, and housing-related predictors over the years. All these predictors primarily signaled who a client is. For example, demographic-related predictors included signals on who someone is by incorporating client age, gender, race, and education level. Health-related predictors provided information on the client or family members' mental or physical health. Housing predictors, again, focused on who the client is by considering the client's prior history of using homelessness support services and detailing one's current or past housing history. What's important to note here is that algorithms in our corpus were largely built using large administrative or healthcare datasets, which regularly contain demographic, health, and housing-related information to signal who the client is. As the green rows in the table here show, however, fewer algorithms in our corpus use difficult to quantify predictors on what a client needs or if the support they need is available to them. There were fewer inclusions of predictors around housing service, housing/service needs, service provider information, and housing service needs predictors sort of signaled how receptive a client is to receive homelessness services, like their willingness to wait for services. And service provider information provided critical data on what services are available to clients. Finally, we looked at the outcome variables in our corpus. We found two patterns. First, we saw algorithms predicting risk, whether it be one's risk of experiencing homelessness-related harms or risk of experiencing homelessness. These algorithms were the mainstay of homelessness algorithms over time. These risk prediction outcome variables essentially focused on assessing the individual. At the same time, we saw an increasing number of resource allocation algorithms in our corpus, with the greatest number of algorithms in 2022. These algorithms were tasked to optimally allocate different resources by matching unhoused individuals' needs to available resources. And unsurprisingly, resource allocation algorithms have increased in prominence in the last 3 years. This trend aligns with the adoption of federally mandated coordinated systems in the US and Canada, which seeks to efficiently match client needs to available resources through prioritization. So in this section, we now discuss the high-level implications of our findings. We first contextualize our findings against coordinated systems in Canada and the US. As previously mentioned, the US and Canada have federally mandated coordinated systems, and these systems consist of 4 components. That is 1, having a central intake point for a client to access support services. 2, use standardized assessment tools to assess client needs. 3, determine which clients to prioritize based on the assessments. And 4, matching clients to available services. Our findings show that algorithms in our corpus largely focused on assessing who is at risk of experiencing homelessness using easily quantifiable predictors like demographic and health information to assess client needs. These assessments would then be used to determine who gets prioritized and matched to high-demand services such as permanent housing. Our findings particularly show that the current approaches in homelessness algorithms conflate risk assessment with service delivery, which can be problematic. We argue this conflation of risk assessment with resource allocation, where risk assessment is based on easily quantifiable predictors, is problematic given the resource-constrained landscape within which the algorithms operate. Conflating algorithmic predictions with resource allocation means skipping asking the important normative and value-laden questions, such as what counts as risk or harm, what types of risks should be prioritized, and for what services. We also want to discuss the rise in resource allocation algorithms. As seen in the figure here, algorithms are on the rise, peaking in 2022. These resource allocation algorithms, in theory, offer an alternative to the previous risk assessment algorithms, as they are designed to account for the resource-constrained landscape of homelessness and efficiently match clients given available support services. However, close examination of the predictors employed in resource allocation algorithms show that these algorithms currently face external validity challenges. Notably, resource allocation algorithms use optimization approaches, which can be perceived as hard to understand black box systems that engender distrust of the homeless system and can leave clients feeling powerless against the system and prevent them from sharing more information about their needs. Our findings also revealed resource allocation algorithms are also currently impractical as they are built on simulation, for example, based on theoretical population sizes. So while the simulations may work in theory, the algorithms can cause the ripple effect trap, where the technology can cause a slew of unintended consequences when deployed into existing homelessness support systems. These algorithms also often assume optimal solutions existed. For example, a resource allocation algorithm may conclude that an individual should enter an emergency shelter. However, this is often an impossible outcome for the estimated 8 to 25% of unhoused youth and adults in Canada and the US who own pets, because most shelters adopt a strict no pets policy. All in all, our survey of literature show that algorithms for homelessness reproduce the status quo of categorizing individuals and matching services to them based on their vulnerability. Risk assessment algorithms predominantly incorporated GLMs and machine learning techniques, which actively sustain the status quo by generating outcomes that follow average patterns identified from historical data to determine an individual's risk of homelessness or related harms. Furthermore, resource allocation algorithms often use simulated data, thus lacking external validity. In light of these findings, we argue we should be reimagining algorithms for homelessness, and they should try to challenge the status quo. Extensive prior work on homelessness has found that commonly used triage tools and needs-based assessments focus on case deficits, which can lead to biased outcomes. Considering the heterogeneity of those experiencing homelessness, we contend future research on homelessness algorithms should buck this trend and design holistic assessments that center unhoused client values. So finally, from our results, we provide the following heuristic design guidelines. We argue we should act as stakeholders when designing technical interventions that support unhoused clients. Researchers can engage with stakeholders through ethnographic work, design workshops, and interview studies to deeply understand the tensions, perceptions, and limitations around computational interventions. Through this approach, HCI scholars can try to articulate how identities and power relations are lost or uplifted in algorithms for homelessness, and question how value-laden questions on how algorithms can or cannot predict risk and who to prioritize. Using a speculative lens, researchers can also engage with stakeholders to push the boundaries on how one can design flexible, strength-based systems that support collaborative decision-making and human discretion. Thank you for your time. I'm Erina Moon, and I am happy to discuss any of your questions on this research via email.